Hello, Dr. Shannon, and hello, Gero555 classmates. My name is Devin Taylor. I usually go by Dev Taylor, and I will be discussing a research article by Anna Good and Elizabeth Aiken, researchers from Australia, actually. The article is titled Dissemination of an Evidence-Based Telephone-Delivered Lifestyle Intervention, Factors Associated with Successful Implementation and Evaluation. So I'll begin with the summary and purpose of this research paper. The author's purpose was to provide a better understanding of how health behavior lifestyle interventions used in research studies are successfully implemented into real community and healthcare settings. This insight is sought through the review of the Australian Optimal Health Program, or OHP, evidence-based telephone-delivered health and lifestyle intervention, which was successfully implemented into real-world settings and used the RE-AIM framework as a tool to recognize factors associated with the successful implementation of this program. As far as OHP, the Optimal Health Program, briefly, it was a 12-month phone-delivered physical activity and dietary intervention, which resulted in significant beneficial behavior changes for patients with type 2 diabetes and hypertension. The experience of this intervention's dissemination is used to facilitate researchers' main focus, which is to point out what is most beneficial and effective on the part of researchers regarding propelling forth successful health and lifestyle intervention implementation and evaluation factors associated with successful implementation of these interventions in real-life settings, as well as research team involvement in these factors. And now we'll cover the main points of the article. First, the authors want us to know that there are few chronicles describing the supports required to facilitate successful dissemination or propelling forward of an evidence-based lifestyle intervention within the real world in literature at this time. And there needs to be more attention to documenting and reporting these required supports. Next, from the OHP intervention, authors learned about the optimal contributions from researchers within each element of the RE-AIM framework to facilitate successful efforts for program dissemination. And I'll go over some examples. So examples of above extra key research team activities within the RE-AIM dimensions that were useful in addition to just data collection for each of the RE-AIM domains that already read about thus far in the class. Specific key activities for each of the domains from the research team included, I'll start with R, REACH. The researchers developed and monitored patient recruitment strategies and targets. For example, they provided a manageable range of referrals per week or per month for the staff to aim for. E, effectiveness. The researchers developed a detailed evaluation plan as well as trained staff in data collection procedures and monitoring of fidelity of data collection. For example, they sent reminders by phone and email to the staff to encourage staff to remember to collect participant outcomes at key important time points. And A, adoption. The researchers developed and monitored practice recruitment strategies, and the authors mentioned one of the keys to OHP success was researcher strength in partnerships with primary health entities. So the research team really was a key factor in adoption of the OHP program amongst providers. They also provided materials like brochures and referral forms. And as far as implementation, this was also a very important area here. The researchers very thoroughly trained staff in program delivery. And I mean, there were hours of training devoted to staff members. And to further give example, researchers gave hours of training, like I said, developed call scripts, developed participant monitoring materials, and held monthly and bi-monthly meetings with the staff, and very carefully monitored the fidelity of this delivery of the program and implementation of the program. So next, I'll go to M, maintenance. Researchers assured ongoing research team support for the implementation and evaluation. And for example, extraction, cleaning, analyzing, and reporting of the data was all handled almost exclusively by the research team, and was very important for maintaining funding and showing proof that the program was working and keeping the program going. So these added efforts from the research team, in addition to data collection for the REAIM framework domains, indicates that collaboration with research partners can be extremely useful for evidence-based implementation and thorough evaluation of a program, and that researchers need to be primed and ready to invest the time and support efforts at the start of the program and continuously throughout the program's implementation into non-research settings. All right, and number 3, the last main point of the authors was that in this OHP example, researchers were crucial to securing recurrent program funding in addition to overall success of the program by providing necessary critical data to prove program effectiveness to organizations that funded the program, as I mentioned earlier. Also, the research team's time, effort, and support is so critical to providing funding initially, as well as training of the staff to be able to not only successfully adopt and implement an intervention program, but also successfully evaluate and report outcomes to continuously provide program funding in the future. However, typical research funding mechanisms do not support ongoing research time in these contexts. So that is a problem. Continuing on to the analysis portion of the abstract, the results and conclusions of the author are as follows. The authors conclude that the study demonstrates collaboration with research partners can be extremely useful for evidence-based implementation and thorough evaluation, and that researchers need to be primed to invest time and efforts at the start as well as continuously throughout this implementation process into a non-research setting. Typically, research funding does not support ongoing research time and efforts, as I mentioned earlier, such as the important examples provided in this article. Because of this, funding for support of the researcher time required to establish and maintain partnerships with healthcare teams to facilitate large-scale dissemination of evidence-based programs should be considered when starting a new project or writing a proposal. Regarding whether I thought this was a persuasive argument on behalf of the authors, yes, I did believe that the authors provided a very persuasive argument. The OHP study was described in brief, succinct detail and was the perfect project to analyze for the dissemination of evidence-based programs into real-life settings. The detail given about OHP was perfect, and it didn't distract me from the real conclusions and focus of the article, which is the researcher's time and efforts. The RE-AIM framework was explained nicely. The researcher actions were also outlined in a simplistic way using RE-AIM, as well as a more thorough way by delving into key actions that made a difference in the success of the project. Tables in succinct paragraph format was used, and the author's points were logical and valid, while easy to read and follow. As far as the topics and themes discussed this week we are discussing implementation, or the I in the RE-AIM acronym. And implementation refers to the extent to which a program is delivered to the non-research setting as originally intended. This article is a great example of how a dedicated and involved research team can take proactive measures to ensure a program is implemented as close to the evidence-based ideal as possible. Specific tactics such as training programs, providing materials to staff, and examples of the amount of meetings and time frames were used and described in this article as well. A large portion of the article focuses on implementation strategy, which is perfect for this week. And next, whether I liked the article or not. At first, I was overwhelmed by trying to get through the article, but that was because I started to read it early on in the semester before we had discussed a lot of the RE-AIM framework. So after other students have led their discussions and lectures from Dr. Shannon, I think this article was a great read for the class. And I feel like there's a wealth of information specific to the OHP example that could be applied to other evidence-based interventions as well. And the authors also draw upon more generalized recommendations and implications of the study for researchers and programs. So although the OHP was briefly discussed, it was definitely not the center of the author's conclusion, and the authors broadened conclusions out to other possible research settings and programs. The only negative was that this article was done in Australia, so their healthcare system is a bit different, and it can confuse someone at first upon reading. Once I focused on the program implementation and evaluation material and content of the article, and not so much on unfamiliar government entities and agencies, I was totally fine. And I did discuss some of the strengths as far as being succinct and using clear paragraphs and as well as table formats as being good strengths of the article before. I feel that I better understand the process of integrating a program into a primary healthcare setting that was originally in a research setting. And I understand that it takes a lot of time and effort and planning. Some of the factors that really matter are who will do the implementing, what doctors or care centers to recruit, surveys and how they will be distributed and what content the surveys will have, patient handouts, program member tools for continuous outreach, and many more things are all very important aspects of research adoption and implementation and maintenance in real life settings. I learned of that meeting on a regular basis and having a training session in person with those who will be in control of the program's success at the start with researchers is emphasized in this article and is obviously important in my opinion. In short, planning thoroughly and having regular meetings and monitoring of program progress and success are essential by program leaders as well as researchers who originated the program. As far as public policy and any changes I would recommend, I would personally urge people to advocate for more funding for researchers so that researchers and students, such as the PhD candidates, so essential to the success of the evidence-based health intervention of the OHP, they are reasonably compensated for their time and hard work to build and set up others to maintain the program. Clearly, the study shows it is worth it, since without the researchers' help and their hard work and dedication and efforts, this particular OHP program would not have been sustained over 3 years and had further funding beyond that time frame. So I encourage you to read the article and read my handout, and thank you for your attention.